Omaha's news leader. This is KETV Newswatch 7's Chronicle.
Good morning and thanks for joining us. I'm Bill Shammer. On Chronicle today, our focus is on male health. Men often have higher mortality rates for certain conditions and are a lot less likely to seek mental health support. Proactive health management is critical for longevity and quality of life. Just take a look at life expectancy data from the CDC. The numbers paint a very different picture between men and women. Men, on average, live to about 76 years old. Women, 81. That's 5 years difference. 60 months, nearly 2,000 extra days. Today on Chronicle, we're going to talk with experts in the medical, mental health, and fitness fields to make sure you or the man in your life are getting the best possible care in the new year. According to DHS, heart disease is the leading cause of death for men in our state, followed closely by cancer. As you can see, other things like accidents are less likely. Lung cancer remains the leading cause of cancer deaths for men in Nebraska and Iowa, but prostate cancer is the most frequently diagnosed in both states. This is consistent with national trends. The American Cancer Society just released their annual report on what to expect in 2026. The good news, cancer deaths continue to decline in the U.S. largely due to less smoking and early detection. The bad news, they're projecting more than 626,000 cancer deaths this year. One recent health headline hit close to home. At just 53 years old, former Nebraska U.S. Senator Ben Sasse has terminal pancreatic cancer. He announced the news in an emotional post on social media just 2 days before Christmas. He's calling the diagnosis a death sentence. Then on January 10th, he shared an update. He just finished his first week of experimental chemo as part of a clinical trial in Houston. Here's Chronicle's Pete Cudahy.
We think of it as life-threatening. So typically, we aren't able to cure stage 4 pancreatic cancer. We can certainly treat it.
Dr. Kelsey Clute, a medical oncologist at Nebraska Medicine, explains there's a spike in pancreatic cancer diagnosis for younger adults like Sasse.
Still nobody knows quite what's going on. But there's a lot of really smart people working really hard to try to understand that because it is scary to see young people getting diagnosed with this.
Part of the problem, most people don't test for it.
The odds of actually finding pancreas cancer in the general population on a screening test is just so exceptionally low that it financially and even logistically doesn't make sense for a general population.
Clute says people with the highest risk of pancreatic cancer include those who have a history of smoking, heavy alcohol consumption, pancreatitis, also known as inflammation in the pancreas, and diabetes.
75% of people with pancreatic cancer also have diabetes that's being actually driven by the cancer.
Symptoms one with pancreatic cancer may experience could include stomach pain, jaundice or yellowing of skin and eyes, diabetes, weight loss, and change in appetite. As of now, treatment is limited.
We're really relying on chemotherapy to treat pancreatic cancer, unfortunately.
But Clute says the future for other treatments looks bright.
There are also some promising immunotherapies in development.
In his post to social media, Sasse says that he's not going down without a fight. He says that death and dying aren't the same thing. Dying is still something to be lived. Reporting from the newsroom, I'm Pete Cudahy, KETV Newswatch 7.
Sasse served 8 years in the U.S. Senate and later led the University of Florida as president, stepping down after his wife's epilepsy diagnosis. Earlier this week, Congressman Mike Flood paid tribute to Sasse on the House floor in D.C., saying his dire cancer diagnosis stunned himself and the world.
From the people of the 1st District and across Nebraska, Ben, know that we are praying for you. We are with you, with Melissa and your kids, and I know you won't back down from this fight.
Congressman Flood said Sasse's intellect and voice has continued to influence conversations across the country. Other lawmakers responded, Governor Jim Pillen saying Sasse is a relentless advocate for Nebraska values, and Senator Pete Ricketts, who took over Sasse's Senate position after he resigned, saying he's grateful for everything Sasse has done for our country. Joining me now to discuss which cancers men are most susceptible to and other male health topics is Nebraska Medicine urologist Dr. Chris Dibert. Dr. Dibert, thanks so much for joining us today.
Glad to be here tonight, Bill.
Now, I know you specialize in prostate cancer, something about what, 1 in 8 men will see at some point in their lifetime?
That's right. About 1 in 8 men will have prostate cancer, and there's a little disagreement on when or how to screen men for cancer. In general, our national urology guidelines focus on ages 55 to about 70, screening with a simple blood test called a PSA test just once a year.
If we get really basic, what is prostate cancer?
Yeah, well, first, let's just put the prostate where it should be, which is number 1, only in men. Number 2, it's just below our bladder, and the urine passes right through it. And it's a cancer where there's not really any symptoms. You don't feel anything with it unless it's quite advanced, and that's why screening can be such a strong tool.
Do we know why men are so susceptible to this? I mean, obviously only men have prostates, but why
That's right.
why it's 1 in 8?
I don't have a great answer for why it's at quite that level, but it is certainly, long has been, one of the most commonly diagnosed cancers in men.
Are there any lifestyle factors that can contribute to this?
Not major lifestyle factors for it. It's really a factor of age and then family risk. So anyone that has a first-degree family relative, meaning your dad or your brother, who has prostate cancer, you are at higher risk yourself.
So those screenings are extra important. All right, let's talk about men's health in general. If you're in your 30s, 40s, 50s, we are inundated with these ads for male-centric health clinics telling us that maybe we have low testosterone. What are some of the pros and cons of clinics like this?
Well, first, let me just say there's no discrete screening test that's recommended for testosterone. It's not like a lot of other cancers, for instance, colon cancer. New recommendation, age 45, everybody, man and woman, should get a colonoscopy. For testosterone, it's really symptom-driven. So what are some symptoms? Lower energy, fatigue, some sexual development side effects as well. Those are some symptoms where men might want to have their testosterone looked at through their doctor's office or through one of these clinics.
You specialize also in sexual health in men. What are some things that you often see going on, and are they fixable?
A lot of them are fixable. I think the big piece to think about for men is erectile dysfunction, right? And the reason that's a big issue is that can be a lead-in for a lot of other disease states. So the major risk factors for erection issues, age is one, but also any sort of heart disease and diabetes. So sometimes we will meet men who are there simply to talk about their sexual health concerns, but we have the opportunity to screen them, ask them, and hopefully diagnose and help them with these other important issues for their health overall.
From what you've found, why do you think men are so hesitant to go to the doctor?
I think it's a time issue, number one, right? If you're out busy working, for anybody, you don't want to pause and take the time to go and check in annually with your doctor. I think some patients still don't feel like there's a strong need or value to see their doctor every year, which couldn't be further from the truth. And this is, again, for everybody, men or women. And then I think some men are just hesitant to talk about what they consider these private areas, whether it's for their prostate and health or their sexual health. They just don't want to talk about it sometimes.
What are the advantages to talking about it?
I think the advantages are that you can identify a number of other health issues, such as diabetes, such as heart disease, and have an opportunity to help screen men for a lot of these other life-saving disease states.
This term longevity right now is really trendy. Outside of diet and exercise, is there anything men can do to boost quality and quantity of life?
I think the main things are the issues we've always been talking about, right? Not smoking, trying to head towards your ideal body weight, and regular fitness. What that means is, individually tailored, but some sort of activity every single day that gets your heart rate up and gets your muscles moving a little bit. Now, specifically in the testosterone zone, it doesn't change your numbers all that much. If you got really fit, if you get in great shape, your numbers aren't going to change all that much, but I promise you're still going to feel better simply if you've lost some weight and are doing exercise on a regular basis.
If there's a man watching this at home or somebody knows a man in their life that's hesitant about going to the doctor, what is your message to them?
Yeah, I'd say there's nothing to lose and only areas to gain. You find a good primary doctor or you come and see us specifically in the men's health area at Nebraska Medicine. Our goal is to try and figure out what's going on for you, what we can help diagnose, and how we can help you feel better, both for the short term and, as you pointed out, for the long term as well.
What if somebody's scared about that diagnosis and would just rather avoid it?
This is just a conversation to start. When you come in, you're going to talk about any symptoms you're having, have a conversation, and then we offer these different screening exams and tests for you. And it's your choice if you want to accept those and have a better understanding of your health or not.
I know you talked about it at the beginning, but when should those screenings start?
So a couple areas. One, for colon cancer screening, that new recommendation is for age 45 for men and women both to have a colonoscopy or some other screening related test. For prostate cancer, the American Urological Association recommends age 55 that a man just have a single blood test to see what their risk is.
Dr. Chris Diver with Nebraska Medicine, thank you so much for joining us today.
Thank you.
Next on KETV News Watch 7's Chronicle, most men know the importance of fixing a leaking roof or a broken sink or that weird noise in the car. But when it comes to their own mental health, I'm fine is usually the full diagnostic. After the break, we speak with a counselor who explains why seeking basic maintenance is not admitting defeat.